Ta-da! Okay. Could we do the little thing where we kind of combine them just a little bit closer together? Hey everybody, Dr. Barrett here, getting these cameras set up, and going to go live here. Just want to make sure everybody can hear me. I'm going to adjust these cameras. So we'll go like these, and go like these, and go like these. That way it looks the same. Okay, cool. Ta-da! Hello guys. Hey everybody, Dr. Barrett here. We are going live right here in Beverly Hills. That is not a blue screen behind me. This is the real deal Beverly Hills. I'm in my operating room. I did a surgery. We are finished. What's up from Norway? Hello, Jonas. I might be going out to Scandinavia this summer. I'm going to do the Berlin Marathon. Anybody from Germany out there? Let me know. Let me know how Berlin is. I haven't been. We're just waiting for everybody to pop on. We're going to talk about implants and Mrs. Thomas 219. We have other associates here. If you want to get surgery, if you can't afford my pricing, we have associate surgeons who are just as good as me that could do your surgery for perhaps a little bit more in your budget range. Okay. Do we have a contact on France? Nope, not yet. And Netherlands, what's up? KLM, that's probably my favorite airline, flying out of Amsterdam. They did lose my bag, but the service on the airplane was really nice. That was last summer. All right, guys, waiting for you guys to pop back in, hop on. We're going live here. We've got a bunch of channels that you guys should check out while we're getting set up here. We have Dr. Daniel Barrett on Instagram. Make sure you check that out. That's where you can see some live surgeries that I do, like the one I did today. You can also check out Barrett Plastic Surgery on TikTok. All right, if you're on my Instagram, you want to check out some fun TikToks like, what we're going to film a little bit later today, make sure you check out Barrett Plastic Surgery. And of course, if you want the in-depth videos and education and transparent content that you're not going to get anywhere else, check out our YouTube page at Dr. Barrett Plastic Surgery. All that stuff is free. Like if you're even thinking about surgery, you just want to learn more about it, check that out. If you don't want to watch the videos, you can listen to our podcast, the Natural Plastic Surgeon Podcast. And in it, we have everything you need to know about certain procedures. We're going to probably update that at some point, but all that stuff is really good information. We'll get going here, and we're going to talk about implants. All right. We're also going to talk about recovery. Okay. In case you guys don't know, I have a bunch of recovery products that nobody talks about. Like, when you go in for surgery for a plastic surgeon, they just prescribe narcotics, antibiotics, stool softener, maybe, if you're lucky, some anti-nausea medication, and that's it. That's all you get. To me, I think you're missing the boat there. So I came up with a product line, some of my own products, some other products that I think are the best, like BioOptimizer's magnesium, the Super Megas fish oil, that are really key when it comes to recovering from any surgery, and especially breast augmentation, which we're going to talk about today. You can find all these on my website, postoprecovery.com. Not making much money off of them. They're the same price you get on Amazon. Here, New John, you want to take that one there? Just check it out there. We can put it all together. We have kits that are specially designed. We have these recovery kits. It's like the ultimate first aid kit. And New John, you want to touch that one too? Anyway, I'm going to kind of start a little general. We probably got about 20 minutes of time here, and then we will dive into your questions about implants and any questions you have about it. Okay. Now, if you're interested in actually getting breast augmentation surgery, learning more, like more for yourself, check out my website, Dr. Daniel Barrett, and you can go on virtual consultations where you can submit an actual request to be evaluated by me, and we can take a look at what your goals are and see what's reasonable and give you a quote, all through the comfort of your cell phone while you're sitting on break at the Burger King parking lot. I only say that because I used to work at a computer store, my first job, and I used to go to Burger King / Wendy's, and that would be my lunch. I would sit in there, and if I had time to go into the in-room dining room, and that would be really fancy, and then I go back to work at the computer store. Anyway, so implant 101. All right, I don't have a saline implant. That would have been good, but They're so hard to keep because they actually pick up a lot of air from the outside area. But basically, step number one is, do you want silicone? Do you want saline? Hands down, silicone is the way to go. All right, and I'll tell you why. Saline is very heavy. It feels like a water balloon. Has a lot of rippling on the side. Silicone is pre-filled, form-filled, so you don't get as much, right? You do not get as much rippling. Look at that. There's no rippling there on the edges. So this is really important for skinny people. If you lean over, you'll see that rippling on the side, or you'll see it in the middle, way more so with saline implants, because there's nothing really holding the shape of the implant. Now with the silicone, it's cohesive bare silicone gel. If you cut this open, the gel doesn't pour out on the floor. It's not a liquid. It doesn't go into your lymph nodes or anything problematic. It can cause a little bit of irritation, but again, it's not spreading throughout your body. In terms of safety, so there's no increase in safety when you go with saline. A lot of people worried, well, if this silicone ruptures, isn't that a big deal? It's not. It's not anymore. So both are problematic though if you get contamination on the implant, right? So that's a different story. I'll get into that in just a second. So saline, silicone, capsule contracture rate is slightly higher with silicone. We're not quite sure why that is. Capsule contracture is when you get that scar tissue around your implant, and make sure you know what your doctor's capsule contracture rate is before you sign up for surgery with that doctor. And the other really key thing is, if you look at a silicone implant, it's got a flat side and it's got a round side, all right? Saline implant has two round sides. So it's just the ball, right? As opposed to a silicone implant can actually be shaped. And this has really important implications in terms of the longevity of your pocket. A silicone implant is going to be very formed to your chest on the flat side and round on the outside. That's important because it doesn't shift off to the side, it doesn't bottom out as much over time. Now, if you get a high profile silicone, it can do that. That's why I always try to say going to moderate profile. We'll talk about profile second. So you'll know saline implants or high profile implants when you see the person in yoga class or Pilates. They look great standing up, all of a sudden they lie down and whoop, they fall off to the side, okay? You know who you are, come see me, I'll fix you, okay? Now, the other thing is, all right, so now we're talking about silicone. There's smooth versus textured. Very rarely are we doing textured anymore because there's a risk with anaplastic large cell lymphoma. It's a rare lymphoma that's been associated with textured. So I would count those out. Along with the textured are the shaped ones, okay? These are shaped, these are round. Typically, you cannot get a shaped implant unless it's smooth, all right? It has to be textured, and that's a reason not to do it. So they tend to be very stiff. A lot of people think, oh, it's shaped like a breast. It looks much better, right? Wrong, because you could get the same result with a round implant, if not more, because if you put it underneath the muscle, it is now shaped and actually get a little more upper pole fullness. So no real advantage to shaped implants. Plus, they rotate, so I stopped using them. I don't recommend to use them, and I don't recommend to use textured anymore, okay? There's just that risk of that rare lymphoma. It's about 1 in 60,000 for mentor implants, but we haven't quite seen that for smooth implants. All right, so textured implants, that's gone. Now we're going to talk about profile. We have different profiles of implants. You've got high profile, you've got moderate profile, you've got low profile, okay? What you want to do, let me make sure this one goes back in my office. This is a memory boost gel. You have memory boost as well, which is kind of a middle category. But basically, my recommendation is stay in the middle. Stay with moderate. Low profile tends to look flat as a pancake. High profile tends to look way fake, way over projected. It tends to be very narrow and tends to fall off the chest. Okay, so that's it on implants kind of overall. Okay, now when it comes to your body, there are different things you need to take into consideration. The three main things that I focus on for my breast augmentations are really good pocket placement. I go partially underneath the muscle, so you want to go below the muscle, not above the muscle. Okay, and you want to make sure that you get a good incision. I like to use the border of the areola incision, but don't go to somebody that doesn't really know how to do that incision. It's very challenging to do right. You can end up with a higher rate of capsule contracture if it's not done right. And so the other option is inframammary. I'm not a huge fan of that scar because it tends to be more noticeable. You wear a bikini, you raise your arms up, you can see it. No difference in breastfeeding ability or nipple sensitivity whether you go border the areola or inframammary. Again, with a surgeon who knows how to do border the areola incision. It's harder to do. I use a lot of things to prevent that capsule contracture rate. My capsule contracture rate is 1 in 200. Nationwide, it's 1 in 20. Okay, so I'm 10 times better than nationwide average. So You want to make sure that your doctor has a low capsule contracture rate, uses a Keller funnel, uses no-touch technique, changes gloves during surgery. Basically you want to see exactly how they do it. There's still a lot of old school doctors out there that are pushing the implant in with their finger, which causes a lot of possible contamination of the implant. And remember, if you get contamination of the implant, you're much more higher to get a rate of capsule contracture, right? So that's what we're trying to avoid with the majority of the steps during the operation after we get that pocket placement. Okay. The other thing is your recovery. A lot of people talk about breast augmentation. I was in bed for 2 weeks. All right. If you go to a doctor that does a lot of rapid recovery techniques and maybe uses some alternative supplements, literally you're back to work at day 4 in my office. Okay. I pre-inject with a lot of numbing medicine so your body doesn't feel the trauma, even though you're asleep, your head's asleep from the anesthesia. I numb up the whole body so that you don't get this upregulation of pain. That upregulation of pain, if you want to know what that means, it's like if you get a splinter in your finger right away, it doesn't hurt right away. A few days later, it starts to get red and gets painful. Okay, that same thing happens to your body if we traumatize the nerves. They get upregulated and you get a lot more pain later on. So we kind of numb up the whole area so we can do the operation and sneak it in like the body didn't even notice and then let it heal. Okay, much less inflammation, much better results. Afterwards, closing the incision, 5 layers. Make sure your doctor does meticulous closure. Make sure you like their results. Right? Make sure you check out their website and you like their results. If you don't like their results, don't call them because that's what you're going to get. And I tell that to people like, do you like my results? Yes, good. All right, good. If not, okay, all right, maybe you're not in the right place. I like to have very natural looking results. Okay, and for guys that you notice I'm in Beverly Hills, yeah, okay. Palm tree, okay. Neiman Marcus. All right, so now recovery. Little did you know, if you're getting implant surgery, fish oil, if you take fish oil, high quality fish oil, right? The stuff you get at CVS is crap. Rancid, inflammatory fish oil. This is a product I recommend, Living Fuel Super Essentials Omegas. I don't make it, but it's the best I found out there, okay? I don't get any kickbacks for them. It's not an ad, but I take this myself. And what it's been shown in studies is that capsule contracture rate goes down by at least 10% by people that take fish oil after the breast augmentation procedure. So make sure you take fish oil. If you want to get this, you can check it out on my website, postoprecovery.com, as well as all these other products, okay? The other thing is pain control, all right? What do you do if you have pain after breast augmentation surgery? Well, traditionally, all you would get is narcotic pain medication. A better alternative is actually treating what's causing the pain. Most of the time, it's muscle tightness and muscle spasms. So we have a really high quality magnesium. Again, stuff you get at CVS is crap. It's just a laxative. Okay, so it's like calcium glycinate or, magnesium glycinate or magnesium citrate. It just goes right through you. This has 7 different types of magnesiums in it that your body can actually absorb so that your muscles can relax. Also helps with anxiety, helps with bowel movements, helps you sleep at night. I take this 2 every night just myself, okay? Postoprecovery.com, you get it there. All right, and then pain control. So CBD is a way to go in terms of pain that's not covered by the magnesium, all right? A full drop underneath your tongue. I care so much about this that I actually developed my own CBD. Why this is different, 1,500 milligrams. Nobody else sells something this strong. All organic. That's important to me. It should be important to you. Additional terpenes that are anti-inflammatory, okay? Nothing else works like this. I have people that take, you want to pop that button there, John? I have people that take this after they're like, oh, I got this CBD at a smoke shop, and they're like, whoa, way better, okay? It's a cute little box too, okay? Barrett CBD. All right, now that works really well, especially for big surgeries and everything else, but sometimes people have focal pain and they want to put something on, so I developed the CBD balm, okay? So this is hot off the press, you guys, Barrett CBD balm. Again, all organic, really good stuff. It literally melts the pain away within minutes. I tested it, I trialed it on all my breast augmentation patients. We put it on, and immediately, pain relief. This is good even if you haven't had surgery. If you have back pain, neck pain, my nurse, she's here. She has an injury from a previous workplace that she puts this now on her neck and she doesn't have anymore. So she's just like sold. So that's the CBD balm. That's also on postoprecovery.com. Nothing else like it. Super strong, just effective, no bullshit. And then I would say the other thing is the Scanuva scar gel. You want to make sure that you don't have a scar after surgery. You want to talk to your doctor about the techniques. Make sure that you're protecting your incision while it's healing initially, and then when it's ready, putting on the scar gel twice a day. You want to do that for at least 6 months. Okay. So we're going to open it up some questions. I have a question, can you explain the benefits of having the implant under or above the muscle? So two main reasons. One, the first and foremost is it looks way more natural if you go partially underneath the muscle. If you go above the muscle, you can see the rounded portion of the implant up top. Okay, we want to avoid that unless you're looking for that, but it wouldn't be here. You want to avoid that fake looking result. So that's why you want to go partially underneath the muscle. And it also reduces capsular contracture rate. That muscle, for whatever reason, helps heal that implant and protect that from getting capsular contracture. Most likely because it clears any potential contamination that might show up. It does reduce your bench press ability by about 15%. So if you're a bodybuilder, you probably, and that's really important to you, that extra 15%, then don't do it underneath the muscle. But most people are not in that category. It also gives you a little muscle animation. So if you flex your chest like that, you would see your boobs move. So that's the one drawback of it. But most people don't go around flexing. You wouldn't get the animation, but they would look fake all the time. So that's the trade-off there. All right, how do you feel about ideal implants? Ideal implants, I actually have it in my office. You want to grab one?
Yes.
You know where it is?
I think we have one in this room.
Oh yeah, cool. So an ideal implant is a saline implant with a silicone shell, and it has different layers inside. Okay, so it's like a baffled type of thing. So I'm going to grab that, and I'll come back to that question in just a second. Okay, can women still lactate and nurse postpartum with implants? Yes. Okay, so here we go. For saline implants, we've got to keep them in this case because they pick up the air from the outside. This is an ideal implant. Okay, so it's a little bit better than a regular saline implant, but it still has some ripples on the edges. Okay, so you guys can kind of see that. These are okay. They're good. They're still heavy. They still feel like a water balloon compared to a silicone implant. And if some people really want, I have them, but I don't really see any of the advantages of them. Okay, I got to keep them in this sealed chamber. There we go. Okay, thank you, Jean. All right, great question though. And then let's back to the breastfeeding. Okay, so the studies say that breastfeeding is limited approximately. We could just move that over here. Approximately 7 to 10%, based on the study you're looking at, your ability to breastfeed is compromised by getting breast implants. So I tell people if breastfeeding is the most important thing to you in the world, then don't get any breast surgery. Okay, but if you're willing to kind of run the risk of that, then go for it. Okay, if you're done breastfeeding, then you don't have to worry about it. You don't want to be actively breastfeeding, getting implants. You want to wait ideally minimum 3 to 6 months after you're done breastfeeding. I have had a lot of patients who get breast augmentation surgery, get a boyfriend, get married, have kids, breastfeed, no problem. Okay, it just seems to happen right after our augmentation. I don't know what it is. Next question, how long to be fully healed and natural looking? I would say fully healed, 6 months. Majority of the result, you're going to see it 6 weeks, at least in my office. Now, if you start out really small and really tight, it could be 9 weeks, it could be 9 months, right? But that's kind of the general time frame. BMI requirement for a tummy tuck, that's a little off topic, but we don't really have a BMI requirement. If you check out my stories on Dr. Daniel Barrett, we did a 30-pound reduction of a patient. She came in the office yesterday, and you can see her post-operative results. Are we going to do a reel on that one? Yeah. We're going to do a reel on that one. So Dr. Daniel Barrett, if you really want to see a massive transformation, we took off 30 pounds of skin off this one lady, totally changed her life. She's super happy. And so obviously her BMI was probably close to 50, but those are unique circumstances. You've got to make sure you're healthy. So I focus on the health, not so much a BMI. Obviously, the lower BMI, the healthier, the better it is for you, less chance of complications and risks. So continue on your weight loss journey, but shoot us an email. Or again, if you were just joining in, you can get a virtual consultation at drdanielbarrett.com, virtual consultations. You can send in your pictures and give you a quote and give you some information, okay? Do I also perform breast reductions? Yes, I do. So if you have an implant that's too big, we can go smaller. Or if you just have natural breast tissue that's too big, I do reductions. I do a lollipop reduction, which is crucially different. Very important you know the difference between anchor scar, right, which has a horizontal component, and a lollipop scar, no horizontal component. You want to go with the lollipop vertical breast reduction. It's a way to go. It's designed by a female doctor in Canada named Betsy Hall Finley. Went and I learned from her how to do it. It is the way to go. You guys, I go live every week. I want to make sure that you guys follow. Please hit the follow button so you're going to get the updates when I go live. We'd love to have you guys subscribe and so forth. But we're reconnecting right here. So okay, here we go. So we'd love to have you guys follow and subscribe so that you guys can get notifications when we do go live. And also make sure you check out my Dr. Daniel Barrett Instagram page and my Barrett Plastic Surgery TikTok page, where we have different types of content. And again, my YouTube, Dr. Barrett Plastic Surgery YouTube, for that more in-depth educational stuff, especially if you're getting very serious about getting surgery. You'll learn everything there. That more than I can teach you right here going live. Is 4 years too soon to replace my implants? No. I mean, if you're trying to change shape or sizes or anything like that, or if there's a concern about the pocket, it's not too early. If you're getting breast work done, you might want to swap them out. But if they're not problematic, then there's no reason to swap them out unless you're concerned about something. And then I'd follow up with your doctor or shoot us an email. Okay. How do you know that the implant you have dropped? Well, it just looks better. We call it dropping and fluffing, right? So dropping is when it kind of drops down a little bit down from the muscle. And then fluffing is when the skin kind of relaxes and grows so that it looks more like a natural breast tissue and kind of folds over. So we'll take a couple more questions, you guys, and then we're going to film some TikToks so that you guys can, and some reels so that you guys have some better content. And then we're going to enter our passcode here for the app to keep that going. Perfect. So 2468. Yep, great. All right, crazy code. All right, yeah, first mine were sitting so high, I was like, what? Okay, so I think, is it bad to leave your implants? Another question, is it bad to leave your implants for 10 years? The data on it shows rupture rate is really low until about 10 years. Then it starts to go up. So I tell people, replace them at 10 years, and then you don't have to worry about it. It's like, you have tires on your car for 50,000 miles. That's what they're rated for. Exchange them at 50,000 miles. You go to 60,000 miles, yeah, you probably can sneak by, but at some point you're going to get a flat tire, or at some point your breast is going to rupture, okay? And then it just becomes a big mess when that happens, all right? It's a lot harder to exchange it. A simple implant exchange is literally a 45-minute procedure. It is a fraction of the price of the original surgery. You just swap it out. It's no big deal, okay? So that's it, you guys. Thank you for joining in. Thanks for watching my live. Make sure you follow all my channels. Dr. Daniel Barrett on Instagram, Barrett Plastic Surgery on TikTok, and my YouTube, Dr. Barrett Plastic Surgery YouTube. And don't forget to follow me. Thank you so much. You guys have a wonderful day from Beverly Hills. Oh, and don't forget about postoprecovery.com.
I put it in the thing.
That's where you get these things. Cool.